Occlusion. The eruption sequence allows primary teeth to assume their proper position. The anterior teeth erupt first. At 16 months, the primary molars erupt and establish the vertical dimension of occlusion. The occlusal surfaces of posterior teeth make contact during mastication. As the maxilla and mandible grow, diastemas form between select teeth. The size difference between a primary tooth and its permanent successor is called the leeway space. A primate space is the largest. In the maxilla, it is located mesial to the canine, and in the mandible, it is distal to the canine. The tongue pushes the teeth out towards the lips and cheeks. The muscles of the lips and cheeks counteract and balance the effects of the tongue musculature. This creates horizontal alignment. A malocclusion can occur due to the overdevelopment or use of a particular muscle group. The open bite you see in the picture on the right is due to a tongue thrust. This is another example of a tongue thrust forcing the maxillary and mandibular teeth apart so that no occlusion is possible between them. Vertical alignment. The crowns of the mandibular teeth tip lingually and the roots tip laterally. In the maxilla, the crowns have a slight buccal inclination with the roots tipping lingually. From a side view, all teeth show a slight mesial inclination. Centric relation is an artificial position of the jaw where the most retruded position of the mandible in relation to the maxilla is created. Centric occlusion is the normal relationship of the jaws that allows the greatest interdigitation of the teeth. It is related to the teeth, not to muscle or bone. In centric occlusion, the cusps of the maxillary teeth overlap the cusps of the mandibular teeth. Maxillary teeth are positioned facially to mandibular teeth and overlap the mandibular teeth. Overjet is a term used to describe the amount of facial horizontal overlap. There is none, moderate, and excessive. In this picture, you can see an excessive overjet. Overbite is the extension of the incisal edge of the maxillary anterior teeth below the incisal edges of the mandibular incisors in a vertical dimension. Here you see very little overlap or overbite, moderate, and severe. The image above illustrates a normal overbite, moderate overbite, severe overbite, and an open bite. In this case, you can see that the overbite is so severe that the mandibular anterior teeth cannot be seen at all. In a normal bite, the buccal cusp of maxillary teeth is facial to its mandibular counterpart. In a crossbite, the mandibular buccal cusp is buccal to its maxillary counterpart. A crossbite can involve any number of teeth. Here are some examples of crossbite. Here, here, here. An ideal occlusion is considered class 1 molar. Dental malocclusions of the teeth include class 2, class 3, and some class 1. In class 1 occlusion, the mesiobuccal cusp of the maxillary first molar aligns with the mesiobuccal groove of the mandibular first molar. The anterior division is known as division 1, where there is very little overjet, and the angulations of the maxillary anterior teeth is normal. In a class 1, you will see what's called an orthognathic profile, which means that it's relatively straight. Overjet is measured clinically by putting a probe at the incisal edge of the maxillary incisor and measuring to where the probe contacts the facial surface of the mandibular central incisor. Overbite cannot be directly measured from the mandibular cusp, so clinically you would measure the perpendicular distance from the incisal edge of the maxillary central to the facial surface of the mandibular central and determine whether 1/3, 2/3, or all of the facial surface of the mandibular central is covered by the maxillary central when the posterior teeth are occluded. In an ideal occlusion, the buccal cusps of the maxillary teeth are positioned more buccal than the buccal cusps of mandibular teeth. Ideally, maxillary teeth are positioned slightly distal to the corresponding mandibular teeth. Dental malocclusions. Crowding where tooth number 24 is in labioversion. Number 7 and 10 are in lingual version. Here, number 8 is rotated or in torsive version, and there is a posterior crossbite. Tooth number 1 is supra-erupted or extruded. This is a unilateral or one-sided crossbite. A reverse crossbite shows maxillary molars which are too far buccal and mandibular molars which are too far lingual. An anterior crossbite is where the lower anterior teeth are buccally positioned in relation to the maxillary anterior teeth. This is a severe deep bite because the mandibular anteriors are not visible. The right side appears to be in a class 1 molar relationship, but on the left side, there's an edge-to-edge relationship. When the posterior teeth are in occlusion and there is space in the anterior or between the anterior teeth, it is called an open bite. In this slide, you see the molars in a class 2 relationship. but there is an excessive labial flare of the maxillary anterior teeth, which is referred to as division 3. Although most orthodontists do not use this terminology, in Europe it is very common. Here we see a class 2 malocclusion, where the maxillary anterior teeth are further forward than the mandibular anterior teeth. This is generally caused by the lower jaw or mandible being positioned more posteriorly than the maxilla. If you look at the profile, the chin seems to be very small, and the anterior or maxillary portion of the face is more anterior than the mandible. In this textbook, divisions are only described in relation to class 2 malocclusion. However, anterior division is independent of molar relationship, and any division can be seen in class 1, class 2, or class 3 classifications. A division 1 depends upon the angulation of the maxillary centrals. When they are tipped out, it is called division 1. When they are tipped lingually or palatally, it is called division 2. Despite the class 2 division 1 appearance, there can be quite a bit of overjet in a class 2. There can also be a deep bite related to a class 2, and in this relationship it is also division 2. Here is a class 2 malocclusion with excessive anterior overjet, or division 3. This slide shows a class 3 malocclusion. That is where the lower jaw is more anterior than the upper jaw. You can see the mandible is prognathic, where the lower jaw sticks out, just like that picture just did. There is generally an anterior crossbite, but not always. The mandible could be retruded. In a class 3 malocclusion, the anterior relationship is often edge to edge or in anterior crossbite. Here is a class 3 malocclusion with an anterior crossbite. Here are some pictures of class 1 molars with anterior division 2. You can see the class 1 molar relationship, but here the anterior teeth are tipped back. This square appearance of the maxilla is very typical of a division 2. Also, this flaring of laterals with a lingual tipping of centrals is also quite typical in appearance of a division 2. Here are some more class 1 molars with anterior division 2. You can see that these are tipped very far lingually, and this is class 2 molar on the left, and this is class 1 molar on the right on the same patient. The ability to recognize division 2 is important because it has been linked with TMJ dysfunction due to the fact that the mandible is forced distally, causing the condyle to put excessive pressure on the articular disc during function as well as parafunction. Notice the typical appearance of the square arch form with crowding on the lower and facial tipping of maxillary lateral incisors or canines with lingual tipping of maxillary central incisors.